For many people, managing ADHD successfully is about using medication. And people have lots of questions and sometimes have some misconceptions about what ADHD medication can do. For many of you who will have been around and are in middle age, then your recollection of what you may have heard about ADHD medication was it was a tablet that was given to naughty children at school. I can assure you that ADHD medication is not a morality pill. That is not how it works. What it does is it helps your brain function in a slightly different way. We know that the brains of people with ADHD and dyslexia, autism, dyscalculia, dyspraxia are structurally and functionally different. But that doesn't mean that there is something wrong with their brains. And again, remember, ADHD is not a mental illness, it is a neurodevelopmental condition. But we do know that when you have ADHD and you don't manage it properly, it can make you vulnerable to mental health problems such as anxiety, depression, obsessive compulsive behaviours, sometimes eating disorders, insomnia, difficulty sleeping. So it is important to understand that managing ADHD successfully is really important. Medication can be transformational for some people, but in and of itself, it is not enough to manage ADHD successfully. So exactly what does ADHD medication do? Well, I mentioned before about structural and functional differences in the brain. There are two neurotransmitters that we know play a key part in ADHD, and they are dopamine and noradrenaline. And there are two different types of ADHD medication: stimulant medication and non-stimulant medication. And we know that these medications are very effective at what they do, but we need to be clear about exactly what it is they do and don't do. They're not a neurological El Dorado. They are not going to solve every problem and challenge that you have in your life. What they may do for you is give you that lift, that ability to begin the process of making the necessary changes that you need to make to your lifestyle in order to manage ADHD successfully. And there are many people, particularly when it comes to their careers, for example, where taking a short-acting piece of medication for their ADHD, because where they experience the most challenge and difficulty is in the workplace. And then there are other people who have shift work, do different types of jobs. I know, for example, a lot of people who are performers who wouldn't take ADHD medication because they think actually it undermines their ability to perform. So it is very much an individual choice that you need to discuss with your doctor, and you need to approach from the perspective that medication would just be one strategy in a whole range of strategies. Non-stimulant medication works on the neurotransmitter called noradrenaline, and it has very similar benefits and takes about 6 weeks to get into your system, and it's active 24/7. There are some people whose bodies just naturally find the non-stimulant medication best for them. Stimulant medication can come in a short or a long-acting application. You can have it in a 4-hour fast-release tablet form, or you can have it in an 8 to 12-hour long-lasting tablet form. And your specialist doctor will advise you on what is probably the best medication for you. But what you have to remember is everybody's brain is unique, and everybody's experience of ADHD medication is unique to them and their lifestyle. So to begin with, you'll be started on a relatively low dose, and over a period of 3 to 6 months, a process called titration. Then that dose will be increased slightly until it's working in an optimum way. And that's something that you would negotiate with a specialist who has initiated medication for you. It is a trial and error process. It might be that after a couple of months you decide you're going to try a different dose or even a different type of medication. If you are going to trial medication, then you need to be realistic about what you think it's going to do for you. People have said to me, well, what does it feel like? And the only way I can respond to that is, in my experience, I don't feel it at all, but I do notice its effects. So again, being mindful that what the medication will do is improve your cognitive functioning. It will enable your brain to work in a way that enables you to better function on a day-to-day basis. It's not an antidepressant. It's not going to undo or unravel perhaps a lot of things that have happened in your life that may have contributed to why you are struggling. But we do know that for many adults, coming to a specialist to get a diagnosis in adulthood is usually because you're in a period of crisis where you are now really struggling. And it might well be that you do have ADHD, but not just ADHD. You may have other mental health problems like anxiety or depression, or perhaps even other physical health problems. And your doctor will take all of those things into account before advising you about whether ADHD medication is right for you, and if it is, what particular type of ADHD medication is right for you. But there are a number of ways that you can help. So if you look at the diagram behind me, we know that ADHD medication is a very effective treatment. We know that cognitive behavioural therapy or coaching can also be very helpful. We know that good lifestyle choices, good nutrition, exercise, drinking in moderation, all of those things all help you manage ADHD. But remember that the most successful outcomes are those people who employ a whole range of interventions. And you also need to understand that if you do begin this journey as an adult, you have to allow yourself a period of 6 to 12 months to start making that adjustment. And again, when you look back on your life, perhaps through that now informed lens of knowing that, well, that was why I used to do that. That was why that happened. I understand it now. That was ADHD. This is what I need to do differently. And as you would have heard from a lot of people in this whole series of video shorts, everybody has found their own way and applied it to their own unique circumstances, their own unique neurology, in order to make sure that they lead happy, healthy and successful lives. My key points to you are, if you do think you have ADHD and you are contemplating a diagnosis, be informed. Read the adult's guide. If you still think that that is you and that you are not managing well, then discuss it with somebody you trust and then go and discuss it with your GP and ask for a referral to a specialist. If you're managing okay, then maybe you don't need a formal diagnosis. Maybe you just need to look at a whole range of other strategies and lifestyle choices in order for you to be able to manage. What matters here is that you get the right information at the right time from the right source that is reliable. And if you do have any concerns, you can always email the ADHD Foundation to get more information. If you're taking ADHD medications and you're experiencing some difficult health problems or experiencing some kind of psychological distress, you may have been on ADHD medications for quite some time, please contact your prescribing specialist. It may well be that you have some other health problem, but when any medical intervention or assessment is taking place for your physical health, your doctor needs to know what your health is from a holistic perspective. So, for example, when we're going to initiate ADHD medication, we might ask for an ECG to check your cardiac health. We will also ask for things like a blood pressure report so that we know you don't have high or low blood pressure. If you do have any concerns about a different sensation or a different experience or another health problem, particularly a problem that is affecting your mental health, then please contact your GP or your prescribing specialist who has initiated your ADHD medication and get expert advice. If you have any serious reactions or adverse effects to ADHD medication when you first start, or if your medication is changed, please contact your specialist immediately, and if necessary, stop taking that medication immediately, but consult with your GP as soon as you possibly can. Remember, these medications can be very effective and very helpful for people, but you are a human being who has all kinds of other health needs. You need to look after yourself, and you need to factor in whether or not other medications may be impacting on how ADHD medication is working for you. I know that for some women who are pregnant, they've had concerns. We do know that for many women, taking ADHD medication during pregnancy is not harmful. If you have any concerns or questions at all about ADHD medication, then always seek expert advice. Please do not rely on unreliable and inaccurate websites or social media platforms. Make sure you get that information from an expert so that you can make informed decisions about your health and well-being and take responsibility for your health and well-being.